Okay, everybody, welcome to Q&A Thursday. I could not be more excited to introduce Casie Danenhauer to you today. She is a colleague of mine and someone that I actually have never met in person. We've only met in the online world, and I seriously, I consider her a friend. I want to give her a hug. I really have enjoyed following her journey and what she's doing these days in her work world and also personal life. She travels and does amazing things, amazing yoga adventures too. So this is going to be a really fun interview today about yoga for pelvic pain. And so before I read Casie's bio, which I'm going to do in just a second, I want to share with you guys that I actually began my yoga journey 20 years ago. I was thinking about this today. I was 16 and I bought my first yoga VHS video cassette, not a DVD, and I plugged it in and I did my yoga in my family's TV room, and that's really where it all began. So I am actually just now finally getting certified to become a yoga teacher. So although I have not yet used yoga in my clinical practice or working one-on-one with people, I have seen the profound benefits just in my own life. And so that's why I'm so thrilled to have Casie on, because she is using it one-on-one with clients in her physical therapy practice. And I know she's just going to be able to share so much with you guys and also with me. Selfishly, I'm excited for this because I can learn a lot from her too. So let me just briefly tell you, Dr. Casie Danenhauer is a doctor of physical therapy and yoga instructor, and she's the owner of Enlighten Physical Therapy, Conscious Care for Pelvic Health in Santa Monica, California. Her mission is to provide conscious care for all of her clients. She combines her skills as a yoga instructor and a pelvic floor and orthopedic physical therapist to create a unique and holistic path towards healing. Her philosophy maintains a balance between evidence-based Western science and an integrative consideration of the physical, emotional, energetic, and spiritual systems. Casie sees clients privately for physical therapy or therapeutic yoga and offers retreats and yoga for pelvic health workshops around the country, and I'm really excited to talk about that too. So Casie, welcome, and I'd love for you to just say hi, maybe fill in any blanks about your journey, kind of how you got to working with pelvic health and yoga. And also, I would love to know how you define conscious care. I love the name of your clinic. And like I said, I've been following it since you opened, and I think it's amazing. But so how do you define conscious care? And again, a little bit more about you.
Sure. Thank you so much for having me again. I guess I'll start off by saying conscious care to me means more mindful, holistic approach with kind of like what you read, this more integrative consideration. So realizing that I'm not just treating a knee, I'm not just treating a shoulder, I'm not just treating someone's vagina, that those body parts are connected to this whole physical body, but also an energetic body, and a body that has to function in this world with other people and other stressors and interact with our environment. So it's really coming from a place of someone who is offering healing services, a reminder of the way that I want to approach all of my clients, which is really individually, and then also encouraging my clients to show up with a conscious awareness of the whole system approach, so that it's not just someone coming to me to be fixed, but realizing that they are a multi-dimensional organism and will need to do work in multiple veins in order to maximize their healing potential.
I love that. That makes sense. Yes, I love it. Mm-hmm.
Thanks. Yeah. In terms of just a little bit about my story, I got into pelvic health in grad school, in PT school actually. In college, I'd experienced some pain with sex and kind of the typical doctor's experience, which was drink more wine, use more lube. Unfortunately, I've heard this story now from many, many women where just been blown off by at some point along the line just saying, good luck with that.
Yeah.
And so when I was in grad school, it was such a relief to find that there might be a musculoskeletal reason for my pain. And I was a gymnast for many, many years, and I had tons of back pain and hip pain. And so it just made sense that, of course, my pelvic floor would be involved.
Yeah.
So I got into taking the coursework. I had a mentor, Judy Florendo in Chicago, shadowed with her, kind of picked her brain, saw the people that she was serving, and they were normal people like you and me, just, having pelvic floor dysfunction, and realized that this is an opportunity to help myself and all of these other people with really basic quality of life issue problems.
Yeah.
And I love treating the runners, the ACL tears and all of that too. But there's something really special about helping someone not pee their pants or not have pain with intercourse or have intercourse for the first time, or those really ring true to me in terms of what I feel like is really important in life. And then it was interesting because I started taking the coursework, and I had never had bladder issues before, but so much of what we were learning about was about stress urinary incontinence and urge incontinence, and it happened to also be a really stressful time in my life, and I started taking on these symptoms.
Wow.
And started having urge incontinence and just episodes of just peeing my pants for no reason, and I was a healthy 24, 25-year-old, and I was kind of mystified by what the hell is going on.
Yeah.
So, and that's really the first time where I realized this mind-body connection, because I saw so clearly, I didn't have any of these issues before, and then they transitioned or kind of came to surface once I started learning about them and being immersed in them and seeing clients who are experiencing them and experiencing a lot of personal stress as well. So my kind of transition into pelvic health was first very straightforward. I started working for a company that only sees pelvic health clients, the Pelvic Health and Rehab Center. And then I realized there needs to be a little bit more in terms of the depth of touching on some of these more complex, non-concrete issues that are affecting people's pain and bowel and bladder function.
Okay, because you'd experienced that mind-body connection firsthand, so you wanted to really, and so I'm assuming that's why you really brought yoga into your practice. Is that true? Yeah. And how do you integrate yoga into, what does a session look like with you, and how does that work?
So everyone's a little different. I don't do yoga with 100% of my clients, but there's definitely a yogic approach in terms of being mindful and using breath. I use breathing techniques with almost all of my patients.
Good. Yeah.
Just being aware of the diaphragm and the pelvic floor connection is such an important treatment tool.
And for anyone who doesn't understand that yet, could you briefly explain what that connection is?
Yeah, so the diaphragm essentially is a dome up structure, and the pelvic floor is a dome down structure. And when you breathe in, both domes or diaphragms need to drop in order to let the lungs fully expand, get a full, deep diaphragmatic breath.
Okay, so when you breathe in, your pelvic floor drops because the diaphragm drops. Okay, yep.
Exactly.
Mm-hmm.
So it's your body's natural mechanism to maintain equal intra-abdominal pressure. Okay. And then when you exhale, there's just this slight rebounding action where everything kind of comes back to normal. And so by teaching my patients that simple technique of coordinating those motions, that already brings awareness and actually relaxation into the pelvic floor, because so many of my pelvic pain clients have no movement to them available at all in the diaphragm or the pelvic floor. So that itself, the movement itself is really therapeutic. And then tapping into the deep diaphragmatic breathing as it relates to activating the parasympathetic nervous system is also really, really important. And one of the major benefits of using yoga and yoga-based approaches in my treatment sessions, for those of you who aren't familiar of that, what that means, so we've got our sympathetic nervous system, which is that fight or flight, what kind of keeps us running away from stress, from the tiger, you know. The opposite of that is the parasympathetic nervous system, which is the calming, rest and digest. Our bodies are not going to heal when we're constantly in that parasympathetic state. Yeah. And so I find it really useful to start my sessions with even just some laying down deep diaphragmatic breathing to stimulate the parasympathetic nervous system. Start turning everything down, turn the notch down.
Yeah. So that's perfect. So that's why yoga, because it stimulates, it gets you out of that sympathetic state and stimulates the parasympathetic state just naturally by way of the pranayama or the breathing exercises. Okay, that's perfect. So how would someone self-identify as a person with an overactive or overly tense pelvic floor or an overly active sympathetic nervous system, and maybe how would they know, okay, maybe this is something I would need in my life, some yoga for the pelvic floor? Can you give any hints on that?
Yeah, I think it can come up in a few different ways. The obvious complaints that someone would come to me with are painful intercourse, specifically for women, urinary frequency or urgency issues, even urinary leaking can be due to a tight pelvic floor rather than a loose or weak pelvic floor. So if someone who is really strong, is a yogi or does a lot of Pilates or is an athlete, chances are they're not leaking because they're weak. Chances are they're leaking because they're actually tight. Jaw tension is really, TMJ issues are really connected.
I would love for you to cover that connection between, the whole body, of course, is connected. The fascia, the connective tissues in the body, and the tissues that bind everything together connects head to toe, really. And so, side note, continue, but if you would love to weave in something about the TMJ and pelvic floor dysfunction, I think that's fascinating, and I think other people would as well. So again, you were mentioning things that people might realize that they have an issue with their pelvic floor. These would be some symptoms that you're talking about. So
others might include like pain with sitting. For men, it might be difficulty with quality of erection or ejaculation. Definitely constipation can be a sign of pelvic floor tension. Those are the main ones. I would say generally if you're feeling anxiety and emotions around like anger, stress, that can also be manifest in your body, in your pelvic floor specifically. Yeah. And then kind of circling back to that connection between the jaw and the pelvic floor, I think there are a couple of things. Physically, you're right, like the fascia and everything is connected. Those muscles, the masseter and the more superficial pelvic floor muscles, are first responders in terms of what tends to turn on or contract in a stress response. Okay. And then energetically, if you think about your pelvic floor and your mouth, those are the two openings of your body. And in a protective response, the response is to close down and protect those two openings so that you can maintain strength and stability and essentially run away from the tiger.
Yep. That's perfect. And that makes so much sense. I remember when I was in physical therapy school, and I remember learning for the first time, just making the connection that the mouth and the anus were two ends of the same digestive tract, really. They're the two ends of the same system. And so really that there's a connection there just between the openings, but then that makes sense about the mouth muscles and the anal muscles being first responders and the pelvic floor muscles being first responders. That makes total sense. So yeah. Fascinating.
If I have a patient who can't tolerate much much in terms of the pelvic floor work manually. We'll do a lot of just around the head and face and jaw and breathing, and you'd be surprised at how often I'm then able to then go to the pelvic floor and work because it's a lot more relaxed.
Wow.
Even just use indirect techniques.
That is so incredible. And and it makes sense also what you were saying earlier about athletes and people who are fit, yogis and Pilates. I actually, when I was in clinical practice, I remember specifically having one of my patients be a Pilates instructor. She was very fit. She was incredible at her work, but she had a lot of pain because of holding a lot of tension in that area and not releasing it as often as her body needed her to. And so are there any other causes that you can think of that maybe we didn't cover for these symptoms that people may have?
Well, there are hundreds
Tons.
of different causes.
Yeah.
Really, that's the skill of the clinician, right?
Yeah.
Is to differentially diagnose what else is going on. Other signs or symptoms would include other things like painful periods or chronic cysts or other kind of reproductive issues. Anytime where there even like repeated UTIs or repeated yeast infections, anytime your organ systems like the bladder or the GI tract or your uterus and ovaries are not functioning or causing some sort of issue, that can be reflected in the connective tissue and the muscle in the surrounding areas.
Yeah.
So it's kind of this cycle that can happen. So either something can be wrong on the muscle level first and then cause these other symptoms that are showing up as more like bowel bladder dysfunction, or there can be an underlying pathology maybe or an infection which then causes the muscle to contract and respond and reflexively kind of clamp down in those areas, which then leads to pain.
Yeah. Okay. Absolutely. And so, now when a lot of people may come to you, say, or their physician, they may think, okay, I have urinary issues, I have bladder issues, I have what have you, I better do some Kegels. So Kegels are a pelvic floor muscle contraction for anyone who's not familiar with that term. So from what we've been saying and what people I'm sure know, that's probably not the best idea for people who are having these pain issues and these tension issues, because of course it'd be like, contracting you're already in a biceps curl and it would be like trying to contract it more when you can't. You have to know how to relax it first. So what is your take? I have, of course, my own take on Kegels. I don't think we should call them bad, but in some cases, I'd love to know your opinion. Are Kegels bad? Some people wonder, are Kegels bad? So what do you think?
Okay, so this is kind of my mission with my workshops and my retreats.
Yeah.
And also just my general conversations that I end up having with people around the pelvic floor is to kind of debunk the Kegel.
Yeah.
Because you're exactly right. And I use that bicep analogy all the time too. Kegels are not bad. Full, free, active range of motion is good. Yeah. So you need to be able to actively contract and bend that bicep all the way. But you do also need to be able to not only extend to neutral, but extend a little bit past neutral, get a full lengthening of that muscle. And the same thing is true for the pelvic floor. So 90% of my day is trying to get people to release and relax their pelvic floor to neutral position. Yeah. I also try to get people to bulge or lengthen their pelvic floor, which you can think of as kind of the opposite of a Kegel. It's that motion that you would get if you are having a bowel movement or like pushing a baby out or passing gas even. So
passing gas quietly. I remember I learned that one. If you're trying to pass gas quietly, that sort of lengthening, right? It's like the gentle lengthening. And it's never just to clarify, it's never a push. I know that, it's never like an bearing down, but it's a lengthening and the bulge, like you described it, is perfect. Yeah.
Perfect. So a lot of the yoga poses that I've actually started to incorporate to this like yoga for pelvic health program are poses that facilitate that pelvic floor lengthening and opening. So not necessarily a bulge, but what I call a drop.
A drop, yeah. Perfect. What are those poses? I've got to know. I'm so excited.
The poses themselves aren't complicated. They are poses that you would run into in any yoga class. However, the cues for the poses are very, very specific. So for example, CatCow is a great active range of motion posture. It's using breath. It's using full spinal flexion and extension. It's that, and for those of you who don't know, it's that pose where you're on your hands and knees and you're kind of going from an arched position to a rounded position. Well, when you come into that arched position, your pelvis tilts forward and your chin looks up to the sky. What I tend to cue, if you were in my yoga class or as my patient, what I would cue for is let your pelvic bones spill forward, let your tailbone curl up to the air, feel your sitting bones widen apart, and notice your breath coming down into your pelvic bowl and stretching your perineum. So the idea is that we're creating this space in the pelvic bowl where the perineum and the sitting bones can lengthen and relax and open. It's a lot of what I talk about with the yoga pose is opening.
I love that. I was just thinking to myself, it just feels delicious. Like I'm not even doing it right now, and I can just feel that delicious, like widening of the sitting bones and the breathing down into your perineum. I love that. That's wonderful. Okay. So that's one of them.
So yeah, other examples can be even just in child's pose, if that's a comfortable position for someone, for their hips and their knees, allowing same thing, the sitting bones to widen, the pubic bone and tailbone to feel like they're kind of coming apart from each other, and the bowl to deepen. And then keeping in that kind of same family of postures, even downward facing dog. I usually cue for with really, really deep bent knees so that the pelvis can stay tilted forward and the pelvic floor can stay expanding kind of up towards the corner of the room.
Okay.
And that facilitates like an opening or a lengthening again of the pelvic floor.
Yeah, and a down. I think most people probably know what a downward dog is, but it's the one where your legs are down here, your bum is up in the air, and your arms are down here. So,
right.
So essentially, you're always focusing. I don't know if I can be seen, but you're always focusing on that anterior tilt of the pelvis and the widening of the sit bones.
Right.
Okay.
And not to say that that's a great posture to be walking around.
No, in the pose.
Yeah. Specifically for the purposes of finding a pelvic drop, it can be really beneficial.
Okay, that's perfect. That's perfect. I have a question. I was wondering, I have actually recently gotten a lot of questions from men specifically, not just women who are having some of these issues, but men as well. Is there anything in your practice, any patient stories or any just tips or tools that you use specifically for men and men's health?
I have about 50% men in my practice, surprisingly.
Wow.
And, just kind of anecdotally, the men in my practice tend to be people with really high stress jobs, maybe graduating grad school or in school. And, I think that there's definitely a very strong connection for male pelvic pain, or what's often misdiagnosed as chronic non-bacterial prostatitis.
Yep.
As being a really intense stress response, so holding in the pelvic floor. So a lot of the principles of what I talk to and what I teach men in my clinic are about the softening, the opening. It's the same thing in terms of pelvic floor release. With men, I try to, and men and women really, I try to touch in on the energetic importance of really checking in with your body's stress response throughout your day and noticing, okay, when you walk into that meeting, what's happening with your pelvic floor? When you get home and you're on the floor with your kids, relax, like what's happening with your pelvic floor then? And realizing that the first step is realizing there is a connection between, what you're doing, what your pain levels are or can be, and this is not to say that all male pelvic pain is due to pelvic floor tension either.
Yeah.
This is a big group of men who I see. But then, like I was about to say, with men and women, energetically, one of my biggest mantras that I use in my clinic is to be more and do less. And that's tapping into the more feminine aspect of our lives. So we generally function in a very masculine world. We've got our linear schedules where we need to be, here at this time and accomplish this, this, and this, and this. And oftentimes there's not much freedom around our kind of masculine lives.
Mm-hmm.
When I try to what I try to facilitate in both men and women is to invite a little bit of more softening and more freedom and more just like self-care and compassion into their day in an effort to see that response in their bodies.
Mm-hmm.
So what does taking a little bit more of a I don't like to say a relaxed approach because I don't mean like go hang out at the beach. I just mean like a little bit more self-compassion in your day and realizing what that does with your symptoms or your tension or your pain.
That's perfect. I actually recently did a video for men, and I said in there, I talked about self-care, and I feel like it's something that maybe women hear a lot about the importance of self-care, and it is hugely important for women, but I've often wondered, and I know you work with so many men, if it's new to them to really think about self-care. Is it? Does that seem to be new? Yeah.
No, I think, the pelvic floor doesn't get much recognition in our world, but when it does, it is for women, right?
Yeah.
Women know about Kegels, at least, for the most part. Men don't necessarily, and men don't necessarily aren't necessarily given the permission to have pain or to go to the doctor or engage in self-care. And so I totally agree with you. Big part of it is just, we're all humans and realizing that we need to make space for self-care in all of our lives, no matter if we have a penis or a vagina.
Yeah, exactly. Oh my gosh. Well, this has been wonderful, Casie. I mean, I could talk to you about this forever. I know that we're rounding in on our 30 minutes and I don't want to take too much of your time. So I want to have you touch on your workshops and retreats. I'm very curious about that. And also anything else that you'd like to leave anybody with, maybe a final take-home tip or message that you might have.
Sure. I'm very excited to be co-leading 2 retreats this year with the great Brianne Miller, who has been doing what I do, but way longer. She's over on the East Coast in Boston. And so we're doing a spring retreat in San Luis Obispo in May. It's a women's yoga for pelvic health retreat, 3 days, kind of a full immersion into the Western anatomy, physiology, function, and then also the more energetic, we'll talk about chakras, we'll talk about feminine energy. So it's a great combination of the two. And then our fall retreat is in October outside of Boston. So it'll be beautiful in the fall and all of that. And it's kind of a similar type of 2-night, 3-day situation. And all of the info related to that is on my website. It's casiegpt.com/retreats. And
Perfect.
then in order to kind of spread the word about pelvic floor, I've been really, one of my goals for this year has been to be doing more of the workshops, so the yoga for pelvic health workshops. And I'm doing 2 kinds. I'm doing one that's geared more towards patients or some people who've never done yoga before. It tends to be a little bit slower and not so flowy. It's more workshop-y in terms of like really breaking down poses and talking in depth about the pelvic floor. And then another version that I'm calling Mindbody Core and the pelvic floor, and that's for more people who have an established yoga practice, but so maybe yogis, yoga teachers who are interested in learning about how the pelvic floor ties in. And I'm leading those consistently here in LA and Orange County, and then I have a few coming up. I'll be in Chicago at the end of March, and in San Francisco beginning of April. So exciting.
Wow, you are all over the place. That is so incredible. And I am all for spreading awareness about this stuff. So I love this. The world needs more of you. So thank you for your work that you're doing. And yeah, thanks for being on the show. On the show. I'm coining it my show now. Thank you for being with me. And if you have anything else you'd like to share, any little last take-home tip that people could use, that would be great. And then we'll sign off. You have anything else for us?
I think my main mantra for the day or for my practice and what I say all day long is just to figure out what being more and doing less means to you and see where you can incorporate that in your life.
I love it. That's perfect. And I will put notes below this video to all of the links that Casie shared, and also being more, doing less. I'm going to write that down too for myself as well. So thank you, my dear. It was wonderful having you, and good luck with everything.
I appreciate it. Thanks.
All right. Bye.